So actually, that's based on the Apple AI kit. It's just announced last year. So Professor Bai have to import this technique, and we combined that to our nodule management. A virtual patient here standing over beside the Professor Bai. So actually, you see no patient there, but it's just a mimic clinician that we can have some tools here. We have the 5 steps A here, and that's just fixed on the platform. So first we see the first A. So on first A we will collect some clinical data, including the smoking history, the history of the cancer, and the TB history, the inflammation. Pneumonia is very important in China, and the chronic disease like COPD, and the history, family history of the cancer, and even the cough and the antibiotics used the history. So first we see the smoking history. Actually, this was a real lung, so we can easily use the 3D revolution technology from the patient's CAT scan. It's very thin now, so we can have a mimic one, and that's just breathing there. You download the apps, you can even hear the breath sound of the patients. And actually, that sound we can go close to that. So I'm sorry, I just to strand by lines, but you can actually go very close, even into the bronchus. So maybe later I will show you this exciting effects. And also we got the module here, we got the model here, ACCP and the LCBP, and the different biological change when patient increase the cigarette amount. And then when the amount of the cigarettes increased, we can see the lung just change. We can find some small nodule in the lung, but it's maybe benign. And then when we increase the smoking, the nodule just become big. So it's very good education materials even for the patient, for smokers, to tell them what happened in the lung. So maybe when the first time they see Professor Bai, they have tiny nodule, but when during the surveillance, their nodule will change. But the patient will not easily understand what happened in their lung. But by this model, they are easily to see that. And finally, we see that the breath cycle have changed, and the volume has changed, and finally, the whole lung has become the black. Yeah. So that's very vivid ones. So we can go increase the lung and to see the bronchus inside the lung. So you can see some mucus directly in the bronchus. And the third one is just the CAT scan. So here we will educate the local physician what's the meaning for the CAT scan, and even the thinner slice scanning. So we have some vivid models to show what we will analyze this, like I show you on the previous slides. So we will see the volume of the nodule, the vessel size, and the bronchus relationship of the nodules with lung nodule. And much more vivid is that here we have a virtual operation demonstration. So we cooperate with our thoracic surgeon department. Professor Ge provided us many data and materials to show what they did in the OR room. So it's very realistic that you see the patient just lying in front of you. Also, we combine some real videos taken from the OR room.